Compassion without judgment. Now, that is the mission at Basic of Northwest Florida in Panama City. Now, the nonprofit agency is dedicated to helping and comforting those living with HIV and AIDS, their family, and their friends. Today, my guest is Valerie Mincey. She is president and CEO of Basic. Valerie, thanks so much for coming back to RAPLINE.
Thank you, Emily. It's a pleasure to be here. It's always great to talk with you, and we appreciate your help in getting the word out about HIV and AIDS.
And on that note, Valerie, what's the biggest message you want to get across to our listeners and viewers today?
To begin with, Emily, I like the community to understand HIV and AIDS is still prevalent. It is still an issue and a health disparity in our community. And I would love to see our community come together to embrace the issue, to talk about it so that we can get better educated, educate our children, our colleagues, our social network, and seeing HIV as a community issue. Anyone who's living with HIV is a part of our community. And those that we are working to educate to prevent themselves from becoming infected is also a part of our community. So the stigma, unfortunately, that we still see in the community, it does not eradicate the disease. It actually perpetuates the problem.
So on that note, let's kind of go back to square one and a little bit about what is HIV and AIDS and how does someone acquire that?
HIV is a virus, and it's human immunodeficiency virus. And what happens is if someone is engaging in a high-risk behavior, which is classified as unprotected sex with the person who's living with HIV, or injecting drugs, using sharing needles with people, or the works, that puts them at risk for HIV. AIDS is a diagnosis, and that's where many people don't quite understand. You catch the virus, you don't catch AIDS. In the diagnosis stage, all AIDS means is your CD4 or your white blood cell count is 200 or below. A healthy person's range 1,200 to 1,500. And their CD4 count is low. They may have a high viral load, which is the actual amount of virus in the body. And the ideal is to get a person on medications, getting quality health care to increase their CD4 count and reduce the viral load, because by having what we term an undetectable viral load with the blood test, meaning 20 copies per milliliter of blood, your virus is so low in the body that it tremendously reduces the chance, over 90%, of transmitting the virus to someone else. So we say that we want people to understand you catch a virus, just like the cold is a virus. And there's no cure, but we have made remarkable strides with medication to treat people living with HIV, where it's become a manageable disease.
Okay, and on that note, let's let folks know a little bit about Basic. You've been around for quite a while, and some people don't realize that.
Yeah, it's ironic that when we're in the community doing our work, we still hear, well, what's Basic? I've never heard of that. And we've really done our very best to be in the community at events, community events, or just working in the communities, going door to door, doing marketing. Basic is the only AIDS service organization that provides comprehensive health care for people living with HIV and AIDS, as well as prevention services. All the services that we provide are free of charge. We cover a 6-county area, which is Bay, Gulf, Calhoun, Holmes, Jackson, and Washington. And Basic was established on December 1st, which is World AIDS Day, in 1988.
Wow.
And Emily, I will be celebrating 20 years with Basic on January 29th. And it's I don't quite know how to describe it to see how far we have come, but I see still yet how far we have to go. There's still a lot of work to be done on education, and understanding HIV and how it can happen to people. It's not who you are, but what you do. HIV does not discriminate against socioeconomic status. It doesn't care how rich you are, how poor you are, whether you live in a mansion or you're homeless, or what your educational level is. It's the behavior that puts someone at risk. And at Basic, we really push know your status, get tested. Testing is free. We test in the office as well as we're mobile. We work the non-traditional hours. We don't have the luxury of working Monday through Friday, 8 to 5, because we want to reach the community where they are, when it's convenient for them. And we have several methods of testing. We, used to be, you got to wait this long time. Well, we have rapid testing now. It's a swab, or you can do the finger prick. Sort of like a diabetes test.
Okay.
And that test will have results in 20 minutes. And if it's non-reactive, you're not positive. If it shows reactive, then we do the confirmatory test right then, which is also a swab, the OraSure. And the results takes about 2 weeks to come back. But in the interim, we begin to talk to the person to determine eligibility for programs, so that when the result comes back, we're ready. If they're positive, they're immediately enrolled in services. And Basic is unique. We're one-stop shop. We have testing, the early intervention, the education, and then they go right to case management. So they don't have to go here and there to receive services.
Everything's right there with Basic.
Everything is right there. And we also offer housing assistance for people living with HIV, because we want to keep them in a stable, clean living environment, and that increases the chances of them being adherent to the medication and improving the quality of their life.
So if someone hearing and seeing this wants to get a test or needs more information, where do they need to go, or is there a website that's available?
Yes, they can either come by our office at 432 Magnolia Avenue, downtown, or they can call us, 785-1088, and our website is www.basic.nwfl.com. We welcome the calls, or we will come to wherever that individual is, because they may not want to come in Basic, and that's fine, and we understand that. So we meet them wherever they are.
And you are listening and watching RAPLINE on GCTV and GC907.org. And we're talking with Valerie Mincey. She is president and CEO of Basic Northwest Florida. There's something very interesting, a pill for prevention of HIV.
Yes. I don't know if a lot of people have heard about it yet. It's called PrEP, Preexposure prophylaxis. And we have the scientific evidence, we have the medications for treatment for people living with HIV. So researchers has found a way to work the other angle, treatment for people HIV negative. You don't have the virus. However, you want to further protect yourself. Right now, our methods are education, get tested, and condom use. However, with PrEP, which is Truvada, it's also a medication that people living with HIV take. But this pill, the research has shown to reduce the chances of someone becoming infected by 92%. In addition to using condoms. So Basic was very fortunate. About 4 months ago, we received funding from Gilead Pharmaceutical to do PrEP education. And we're doing outreach in the community to educate people on PrEP, as well as working with our medical community on working with individuals in prescribing PrEP. With PrEP, it's one pill a day. And they have to have an HIV test every 3 months to ensure that they are still HIV negative. And we get lab work done to do that, as well as test their kidney functions, because this drug can impact the kidneys. But it has proven to be tremendous success. We do have individuals in the community that are on PrEP for further protection of HIV. But again, we strongly encourage, if you get on PrEP, you still need to use condoms.
So who would be a good candidate for PrEP?
That's a very good question, Emily. Anyone who may be in what we term a serodiscordant couple relationship, meaning one person is positive and the other one is negative. That person is definitely ideal to be on PrEP. Or anyone who is engaging in unprotected sex, they are good candidates. Or an injecting drug user, a great candidate. Substance abuse use, anything that alters your thought process and clouds your judgment in making good, sound decisions when it comes to high-risk behavior.
Now, you mentioned condom use, and let's get the word out about that and how important that is.
Condom use is extremely important because until PrEP, that was the only thing that we had that we could educate people on in protecting themselves. And the condoms are free. We have them all throughout basic. Our local health department has them. They're free. We have various locations throughout the community that have baskets that basic or the health department supplies free condoms with. So they are accessible throughout our 6-county area. But anyone who's having sex with a partner who they don't know their status, they need to use condoms. And we encourage people, get tested together, because as the saying goes, and we've known for years, every time you have unprotected sex with one person, you're having unprotected sex with everyone they've ever had sex with in their entire life. It's not just that person. So HIV is preventable, but we can only do so much. Individuals have to take responsibility and care enough about themselves to protect themselves as well as their partner.
Now, as we're talking about free testing, of course, the free HIV testing.
Yes.
But now you're also doing testing for hepatitis?
Yes, we are. Basic does hepatitis C testing now, and it too is a finger prick. And we are mobile with that test as well. Not only can we do it in the office, but we can also do it in the field. We've received training and approval from the state health department. And so Basic, along with the Bay County Health Department, provides hepatitis C testing for free as well.
And hepatitis is a liver disease?
Yes, hepatitis is a liver disease. We deal with a few cases of hepatitis A and B, but C has become very, very prevalent. And the reason is it can lay dormant in your body with no symptoms on average for about 20 years. Yes, it's really severe.
And what is the difference between the C and A and B?
Well, A and B is usually contracted through bad shellfish. Bad oysters, and I love raw oysters. B is primarily, you can get it through sex, injecting drug use, sharing needles. And C, not as much through sexual contact, but it can be transmitted that way, but a lot through injecting drug use. And years ago, we had this big heroin problem, and ironically, it's back again. We do see cases of heroin use again. So we're really pushing the case for hepatitis C. And also with HIV, hepatitis, any sexually transmitted disease, these illnesses have been around a long time. But we have to remember, we have a whole new generation now that has come up. And they weren't alive when the epidemic was devastating, when people were diagnosed and 6 months later, unfortunately, they died. Because of medications, people are living so much longer. So in our counseling and community activity, we're hearing, well, I'll just take a pill and I'll be fine. but it's not that simple. You're on this medication for life. Sometimes they have side effects. It's a matter of working as a care team, as we describe it, the case managers with the doctors and the nurses, with the patient to ensure you know what you're doing, you know what you need to do, and closely monitored.
Now, Valerie, is there a relationship between HIV and hepatitis C?
The relationship is, let's say if you are, for one, just have hepatitis first, but you continue to engage in high-risk behavior and you become HIV positive, or even vice versa. We have to monitor both. And we look at, let's say, for example, your liver functions start failing. Well, we have to treat the hepatitis aggressively. And then that's going to impact your HIV status and your health care as well, or vice versa. We have a lot of people who are dual diagnosed with HIV and hepatitis. So they're monitored very closely because the medications you can have an HIV medication that is not good for people who have hepatitis. So the doctors run tests, genotype, phenotype, to ensure that both statuses are like in maintaining levels per se. So it's really tricky, and that's why we are pushing testing so much for people to find out, because early diagnosis means early treatment and a longevity of your life.
And Valerie, you've worked with so many people over the years. Can you share with us some stories that have really impacted you, either positive or negative stories? But I know that you've just done a lot of work and seen a lot of things.
Yeah, I have, Emily. And I have to say, it's my passion. I love what I do. I love the community and the people that we serve. And I'll never forget when I was first working in the field and used to go out and do education and work with the schools. And this kid, I was in the mall one day, and this kid screams out, hey, you're that condom lady. I'm like, oh my God. So I see everybody around me start turning around and looking. I couldn't help but smile, because to me, I saw that as a great thing. That child remembered me. They remembered what they were taught, and he walked up and said, thank you. You really probably saved my life. So I see people that I did education classes with now, so many years ago, and yet they still remember me, or some staff member at Basic, educating them and testing them and coming back and say, hey, thank you for what you did. And then, unfortunately, I remember when we first started doing HIV testing, my first positive result that I had to give back. Oh, Emily, that was one of the toughest things that I've ever had to do. And just so you know, it never gets any easier, because we know we're about to change someone's life. So I talked to her and we counseled her, connected her to services, but her choice was to not go on medications. Now, this was back in 1997, but at the time we had less medication and didn't know as much as we do now, but we did all we could. And that's the thing. We can put everything there for a person, but they have got to want the help. And unfortunately, this person passed away 2 years later. And I was just so devastated, because they had a family. And I truly feel that medications could have saved their life, because we see it every day. We have clients that's been living with HIV over 30 years, and they're doing remarkable. And that's why HIV is classified as a manageable disease now. There's so many choices. Medications are not a handful 2 and 3 times a day now. It's 1 pill a day. So I don't know how much better we can make it, but our goal is to reduce the number of new infections, to stop new infections altogether, get people educated, and to really understand the disease, stop the stigma. It doesn't help. we're not in a position to judge because working at Basic, we see it can happen to anyone. And people living with HIV are some of the most loving people that you could ever meet.
And with that, again, free services at Basic.
Absolutely.
And that medication, if someone needs it, free.
Yes, we're there. We're funded through state grants run White Part B, where we can pay for the medications, we can pay for their doctor visits. If they have insurance, we can help with co-pays, deductible, dental services, health insurance premiums, support groups. I can go on and on. We try to identify any gap in services and find funding to meet that gap. We also depend on our community for support because grants don't pay for everything. And so we've identified funds and secured funds to help people get eyeglasses, just things that they need to improve their self-esteem and how they feel about themselves. So we address all those needs.
Now, what about support groups?
Yes, we provide support groups. We have monthly support groups, one here in Bay County and one in Jackson County, so that people don't have to travel so far. And one of the things we have also is transportation vouchers to help people get to their medical appointments, pick up their medications, get to work, and to get to support groups. And our support groups are just engaging. It's not all about HIV. We learn about the HIV medications. We teach about that, but we also teach about nutrition, self-hygiene, mental health, which is a big issue, not just with HIV, but just in general in our community. But we do activities for Christmas. They decorated ornaments and did Christmas trees. And for Easter, they do Easter egg hunt. St. Andrew's Episcopal Church is a great partner of Basic. They host movie nights. So we can get our clients to see you don't have to totally talk about HIV each and every day. We want to help them build a social network and to have a good, diverse life.
And with that, as we're getting ready to wrap up here, the biggest words of advice that you want to get out to listeners and viewers?
My biggest words, Emily, is to get tested, know your status, support people who are living with HIV, not judge them, because they're still productive citizens in our society. And always remember, HIV can happen to anyone. And agencies such as Basic or the services at the health department or our local community health center, Penn Care, we're here to help. Our private physicians are wonderful and providing the best quality care that anyone could possibly have. And we also ask our community, please support Basic, because there's things that's needed that grants don't cover, and we're very good stewards over every dollar that people entrust to us. And I definitely like to add that Hess Entertainment, Mark Hess, they do concerts and programs here. Well, they have a show coming up. Patti LaBelle is coming to Panama City. Who doesn't love Patti LaBelle? So Mark has chosen Basic as a charity to give a percentage of the proceeds to help us continue the work that we do. So we encourage everyone, go get your tickets. I've got mine. I'm going to see Patti LaBelle. But get your tickets, and they can go to herocks.com to purchase their tickets. But to the community in which I am a member, so are our clients. Stop the stigma. Learn about HIV, and when you learn, educate others, your social network, and especially our young people. Again, they weren't here during the epidemic, and the rates of infection have drastically increased in our young population, ages 18 to 24. So we have a responsibility to them to educate them.
And that's a big deal. I know we were talking before the show that young people, as you just said, are falling victim to this.
Yes, young people are becoming infected at a higher rate than anyone. And the funding sources we do target populations per se. And right now, the highest rates of infections that are occurring are among our young Black gay male. However, we see the epidemic has come full circle. Emily, remember when we first started, it was called GRID, Gay-Related Immune Deficiency. And then the epidemic increased in the Black population and now our young population, even the elderly. Well, Basic's approach is let's target everyone. Everyone should be targeted with the same message, same information, and have access to the same quality of care. If we do that, we can stop new infections from occurring.
Education, always the big key there.
Yes.
And again, if you are looking for information, you can contact Basic online. You can give them a call. And the website again, Basic?
It is www.basicnwfl.com.
All right. Valerie Mincey, thanks so much for coming on RAPLINE again and sharing that information.
Thank you, Emily. It's always a pleasure to be here. And thank you and RAPLINE and Gulf Coast College for what you do for Basic and the community.
Well, you're very welcome, and we're happy to get that information across. That is a wrap for this edition of RAPLINE. Thanks again to Valerie Mincey with Basic, Northwest Florida, for coming on the show and sharing very good information. And as she said, education, prevention, contact them if you have any questions or concerns, or to get those free tests as well. And of course, if you are thinking of adding a pet to your family, consider the adoption option. Check out one of the many local animal rescue groups. You can also check out our Pet of the Week on our GC 90.7 Facebook page. This is RAPLINE on GCTV and GC 90.7 FM. Thanks so much for watching, and have a great day.